Welcome, everyone. I'm excited to kick off our presentation today on patient education. This is our first slide, so I want to warmly welcome you all and introduce our topic with enthusiasm. Today, we'll explore the importance of patient education, how it improves healthcare outcomes, and some effective strategies to implement. We'll briefly cover key concepts and practical approaches, so let's get started. Welcome to today's discussion on patient education. As nurses, we know that educating our patients is a crucial part of the care we provide. It's not just about giving instructions, it's about empowering patients to understand their health conditions and make informed decisions. When patients are well informed, they can participate actively in their own care, which often leads to better outcomes. Nurses have a vital role in this process. We're not only caregivers, but also teachers and advocates for health promotion. Through effective teaching, we can help prevent illness before it happens and support our patients in managing existing health issues. So, understanding how to educate effectively is essential because it directly impacts the overall health and well-being of those we care for. This slide highlights the importance of patient education as a key component of holistic nursing care, aligning with our goal to promote health and prevent illness through knowledge and support. Let's start by understanding what patient education really means. Essentially, it's a process aimed at influencing how patients behave, but it's also about creating meaningful changes in their knowledge, attitudes, and skills. The ultimate goal here is to help patients maintain or even improve their health. It's important to note that this isn't just casual conversation. It involves planned and organized learning experiences. These are structured efforts designed to ensure that patients truly grasp what they need to know and can apply it in their daily lives. By doing this, we're empowering patients to take control of their health, which is a key theme in our overall discussion today. Patient education isn't just about sharing information. It's about fostering understanding and encouraging positive behaviors that make a real difference in health outcomes. Let's talk about the importance of patient education. When patients are well informed, it promotes their independence and self-care. This means they can manage their health better and feel more confident in taking care of themselves. Additionally, educating patients helps improve their compliance with treatment plans. When they understand the reasons behind their medications or lifestyle changes, they're more likely to follow through. This also plays a big role in reducing hospital readmissions. When patients know how to manage their conditions at home, they're less likely to need to come back to the hospital unexpectedly. Furthermore, patient education enhances their overall quality of life. By understanding their health and how to maintain it, they can enjoy a more active and healthier lifestyle. It also encourages active participation from patients in their own care. When they are engaged and informed, they become partners in the healing process. And finally, effective education strengthens the nurse-patient relationship. Trust and communication grow when patients feel understood and supported through education. All these points highlight how fundamental patient education is to delivering quality care and achieving better health outcomes. Let's take a closer look at the purposes of patient education. First, one of the key goals is health promotion and illness prevention. This means helping patients adopt healthy behaviors and lifestyle choices to stay well and avoid future health problems. It's about empowering them with knowledge to make informed decisions. Next, patient education also aims at the restoration of health. When someone is already ill or recovering, education helps guide them through treatments and self-care strategies to facilitate recovery and regain their optimal health. Finally, there's the aspect of coping with impaired functioning. Sometimes, illness can limit a person's abilities, and education plays a crucial role in helping patients adapt to these changes. It provides them with the skills and confidence to manage daily activities despite their limitations. Overall, these purposes are interconnected and form the foundation of effective patient-centered care. They highlight how education is essential not just for treatment, but for promoting overall well-being and resilience. Today, I want to talk about the goals of patient teaching, which are really central to providing effective care. First, Our main goal is to help patients achieve optimal health. That means supporting them to reach their best possible physical and mental well-being. Next, we want to improve their self-care abilities. Empowering patients to take care of themselves is key to long-term health success. We also aim to foster positive health behaviors. Encouraging habits like proper nutrition, regular exercise, and medication adherence can make a huge difference. Lastly, ensuring safe continuity of care after discharge is critical. We need to prepare patients so they can manage their health safely once they leave the healthcare setting. All of these goals tie back to the overall theme of patient-centered care, making sure patients are equipped, confident, and supported throughout their health journey. Now, let's take a closer look at the process of patient teaching. This process, known as the teaching-learning process, is essential for ensuring that patients truly understand their care and can participate actively in their health management. It includes 4 key steps: assessment, planning, implementation, and evaluation. First, assessment involves gathering information about the patient's current knowledge, needs, and readiness to learn. This step helps us tailor our teaching to fit their specific situation. Next is planning, where we develop a teaching plan based on the assessment, setting clear, achievable goals. Then comes implementation, which is actually delivering the education through appropriate methods and materials. Finally, evaluation allows us to determine whether the patient has understood the information and can apply it. This cycle is critical because it makes our teaching patient-centered, adaptable, and effective, ultimately supporting better health outcomes. As we move forward, keep in mind that understanding and applying this process is fundamental to successful patient education. Let's talk about assessment. When we're working with learners, it's crucial to evaluate several key factors. First, we need to assess their learning needs. What do they actually need to learn to achieve their goals? Next, understanding their readiness to learn is essential. Are they mentally and emotionally prepared to engage with the material? We also have to consider their ability to learn. This includes their current skills, knowledge, and any potential barriers they might face. Another important aspect is learning style. Recognizing whether someone learns best through visuals, listening, hands-on experience, or other methods allows us to tailor our approach effectively. And finally, we shouldn't forget their support system. Who is in their corner to encourage and assist them along the way? By thoroughly assessing these areas, we can create a more personalized and effective learning experience that aligns with the overall goal of empowering learners and ensuring their success. Now, let's talk about the next crucial step in effective planning. First, we need to set clear learning objectives. Knowing exactly what we want to achieve helps guide everything else. Then, we decide on the content, what topics or skills we want to cover, and choose the most suitable teaching methods to engage our learners. It's also important to arrange the timing and location of our sessions to ensure everything runs smoothly. And don't forget, including family members can be a great way to support the learning process and create a more collaborative environment. All these elements work together to make our planning thorough and purposeful, which ultimately leads to better outcomes. Let's talk about implementation. To make sure our efforts really stick, it's crucial to create a supportive environment. This means fostering a space where everyone feels comfortable to participate and share. Using simple language is key. Complex jargon can create barriers, so clear and straightforward communication helps everyone stay on the same page. Demonstration is also very effective. Showing how things are done brings clarity and builds confidence. Encouraging questions and feedback is another essential piece. When people feel safe to ask questions, it promotes understanding and engagement. Plus, feedback helps us improve and adapt our approach. Remember, all these points connect back to the bigger goal of effective implementation. It's about making the process smooth, inclusive, and engaging so that the changes we want to see are more likely to succeed. Now, let's move on to the evaluation stage. This is a crucial part of the learning process where we assess whether the learner has truly grasped the material. We do this by evaluating learning outcomes, which helps us understand what they've learned and what might need further reinforcement. Next, we ask for a return demonstration. This is where the learner shows us they can perform the skill or task independently, confirming their understanding in a practical way. Reinforcing key points is also essential. It helps solidify what's been covered and ensures the core concepts stick with the learner. And of course, documenting the results is an important step. Keeping records of how the learner performed allows us to track progress and plan future learning needs. Overall, this evaluation process ties together the entire training, making sure that the knowledge is not just theoretical but truly applied and retained. Now, let's take a closer look at some of the key factors that influence learning. First, age plays a significant role because it affects how quickly and easily someone can absorb new information. Younger learners often pick up skills faster, but older learners can bring valuable life experiences to the table. Next, health status is crucial. If someone is unwell or has health challenges, it can hinder their ability to focus and retain information. Culture also has a strong impact. Our cultural background shapes our learning styles, preferences, and how we interpret information. Motivation is another critical factor. When learners are motivated, they tend to engage more deeply and persist through challenges. The environment where learning takes place matters as well. Whether it's a quiet classroom, a busy home, or an online setting, the environment can either facilitate or hinder learning. Family support cannot be overstated. Encouragement and assistance from family can boost confidence and provide additional resources. Education itself is a factor, as prior knowledge and foundational skills set the stage for new learning. When we consider all these factors together, we see that learning is a complex process influenced by multiple interconnected elements. Recognizing these helps us create more effective, personalized approaches to teaching and supporting learners. Now, let's explore some of the key teaching methods that can make our instruction more effective. First, we have lectures and discussions. These are fundamental because they allow us to convey information directly while also encouraging students to engage and share their perspectives. Next, demonstration plays a crucial role. Showing how something works or is done helps to clarify complex concepts. Printed materials are also important. They provide students with resources they can review at their own pace and serve as useful references. Additionally, audiovisual aids can make learning more dynamic and memorable by combining images, sounds, and videos to reinforce key points. Finally, online resources offer flexible, accessible tools that students can use anytime and anywhere, supporting varied learning styles and needs. All these methods, when integrated thoughtfully, help create a richer, more engaging learning experience that aligns with our overall goal of effective teaching. Let's walk through how we can integrate the nursing process into teaching. First, we start with assessment, where we identify the learning needs of our patients. This step helps us understand what they already know and what gaps exist. Next is diagnosis, where we recognize a knowledge deficit, meaning we pinpoint exactly what the patient needs to learn to improve their health or manage their condition effectively. Moving on to planning, this involves setting measurable goals that are specific, achievable, and focused on closing those knowledge gaps. During implementation, we carry out the teaching, delivering the information in a way that's understandable and engaging for the patient. Finally, we reach the evaluation stage, where we assess the learning outcomes, checking if the patient has grasped the information and can apply it. This entire process ensures that our teaching is patient-centered, effective, and continuously improving, which aligns with the overall goal of providing holistic and quality care. Now, let's talk about the crucial role nurses play in patient education. First, identifying learning needs is essential. This means understanding what the patient needs to know to manage their health effectively. Once we know that, we can plan and organize teaching strategies that are tailored to their specific needs and learning style. Using effective communication is key here, making sure our message is clear, respectful, and engaging so the patient truly understands. We also need to evaluate their understanding. It's not enough to just deliver information. We have to check if they've grasped the concepts and can apply them. And finally, documenting our teaching activities is vital for continuity of care and accountability. By carefully recording what we've taught and how the patient responded, we ensure that everyone involved in the patient's care is on the same page. All these steps are interconnected and highlight how nurses are integral in empowering patients through education, which ultimately supports better health outcomes. Let's talk about some common barriers to teaching that can really impact how effectively we communicate important health information. One major obstacle is language barriers, which can make it difficult for patients to understand instructions or ask questions. Then, there's low literacy, which affects a person's ability to grasp written or even spoken information, making education more challenging. Lack of time is another significant factor. When we're pressed for time, it's harder to have thorough, meaningful discussions. Pain and fatigue can also be barriers, as patients dealing with discomfort might not be receptive or able to focus. Lack of motivation can prevent engagement, especially if patients don't see the immediate relevance or benefit. Lastly, distractions, whether it's noise, other responsibilities, or environmental factors, can divert attention away from the important messages we're trying to deliver. Recognizing these barriers is essential because it helps us adapt our approach and ensure our teaching is as effective as possible, aligning with our overall goal of improving patient understanding and health outcomes. Now, let's talk about some effective strategies to enhance learning. First, using clear language is essential. When instructions are straightforward and simple, learners are more likely to understand and retain the information. Next, involving family can make a big difference. When families are engaged, they provide additional support and encouragement, which boosts motivation. Providing written instructions is also very helpful. Having something to refer back to reinforces learning and reduces confusion. Repeating key points ensures that important concepts stick in learners' minds. And finally, offering positive feedback is crucial. Encouragement builds confidence and fosters a positive learning environment. By integrating these strategies, we can create a supportive and effective learning experience that aligns with our overall goal of promoting understanding and growth. When it comes to documentation, there are a few key elements we want to make sure we include to keep everything clear and organized. First, noting the date and time of the interaction or activity is crucial because it helps us track when things happened. Next, clearly stating the topic ensures that anyone reviewing the documentation understands the subject matter at a glance. We also want to specify the method used, whether it was a meeting, an email, or a phone call, so that the context is clear. Documenting the response is equally important. It captures what was said or done in reply, providing a record of outcomes or decisions made. Don't forget to include any materials provided during the interaction, such as handouts, reports, or digital files, so that everything is accessible later. Lastly, outlining follow-up plans is essential. This keeps the process moving forward and ensures accountability. All these components work together to create thorough documentation that supports transparency and continuity. Remember, good documentation is the backbone of effective communication within any project or team, tying all parts of our overall process together seamlessly. So, in summary, I want to emphasize that patient education really plays a crucial role in improving health outcomes and fostering greater independence for our patients. When patients understand their conditions and the steps they need to take, they're more likely to manage their health effectively. And, as we've discussed throughout this presentation, the nursing process offers a clear and structured framework that guides us in teaching our patients. It helps ensure that our education is targeted, organized, and tailored to each individual's needs. Ultimately, combining patient education with the nursing process empowers our patients and leads to better, more sustainable health results. And that brings us to our references, which are essential for grounding our practice in well-established knowledge. First, we have Cozier and Erb's Fundamentals of Nursing, a comprehensive resource that provides foundational nursing concepts. Next is Potter and Perry's Fundamentals of Nursing, which offers in-depth insights into patient care and clinical skills. We also drew on Taylor and colleagues' Nursing Fundamentals, known for its clear explanations and practical approaches. Additionally, the WHO Health Education Guidelines serve as a global standard, emphasizing the importance of health promotion and patient education. These references collectively highlight the importance of evidence-based practice, continuous learning, and adherence to international standards, all of which are critical to delivering safe, effective, and compassionate nursing care. Thank you for your attention throughout this presentation.